Happy to have you here today. We're delighted to hear you speak to us about recent legislation in California affecting transfer of medical information and what A Voice for Choice sees ahead in 2023. Welcome, Christina.
Thank you. Thank you for having me. So yes, that's a wonderful description of what I do. And I know many of you on this call I've met, and some of you in person, some of you across the way somewhere. So it's wonderful to see you all today. I didn't put together a presentation from the perspective of sort of showing slides or anything like that. And I'm the type of person that I love sort of interactive presentation. So if anyone has a question along the way, feel free to ask. I will have a Q&A at the end. I do have, as Christy mentioned, I do have a few things that I'm going to talk about, and I don't want to get too far off of them during the initial presentation, but I'm happy to answer questions if they pertain to what I'm talking about. So I wanted to kind of go through last year and how it looks this year in the California legislature. A Voice for Choice and A Voice for Choice Advocacy are two organizations, my two organizations. The A Voice for Choice is our 501c3, which is educational, and then A Voice for Choice Advocacy is our 501c4, which is advocating, and we do stuff in the legislature. I'm going to wear my A Voice for Choice Advocacy hat today. I can cover stuff at A Voice for Choice too that way, but if I just wear my A Voice for Choice one, I shouldn't really be talking about advocacy. So that's where I usually sit when I'm talking to people, but we do have both organizations, and we work on slightly different projects on both with both organizations. So last year, 2022, here in California, and we are based, that was where I was getting with this, we are based in California. So I'm going to focus on California. A Voice for Choice Advocacy is part of Stand for Health Freedom, which is a national organization that basically has a group in nearly every state that is their sort of representative in that group. And so we get together monthly for calls, and so we hear what's going on in different states. We share what's going on in California, so we can really learn from other states and they can learn from us. And so I do have sort of a national picture on this, but where we sit is really in California. So I'm going to focus on that, but if you have questions outside, I may or may not be able to answer them. I can definitely put you in touch with the people in that state that would know a lot more and be on top of the day-to-day stuff as we are in California. So where we came from last year, I'll probably actually go back to 2015, which is when A Voice for Choice Advocacy started. 2015 was SB 277. Senator Pan decided to he wanted to remove the personal belief exemption for the vaccines for children for going to school in California, and was successful in that. About halfway through that legislation, the first half, I was just your regular old mom going up to the Capitol thinking, we're going to beat this. Washington beat it, Oregon beat it, Carl Canthink, sorry, I can't say your name, was instrumental in trying to help us put together slides and presentations for legislatures to show them that this just wasn't worth it. California is a special place, and I think we've all realized over the last 8 years that it's become an even more special place in that sense. I will look back on that time. I don't know what prompted me to go from sort of the mom that was just going up to the Capitol to being what I am today. I would say, it's my kids, but it's really more than that, because it's all of my kids. It's all of the kids of California. It's not just my kids. I think the pivotal point was we were in the Capitol, and it was the Education Committee, and Pan did not have the votes in that committee. And we really thought we had beat the bill at that point, and really were excited about it. And the chair of the committee looked at him and said, "You don't have the votes. Would you like to come back next week and vote on this?" And we didn't even know that could happen. I mean, we were so naive. I was naive about how this whole process worked. And he said yes. He worked for 5 days, horse traded whatever he needed, and he got the votes, and that kept it going through the legislature. We've had ups and downs in the last 8 years when we don't have any legislation that we're opposing. There's usually one bill a year that we oppose. We've had some successes in 2017. There was a bill that was called the Parental Rights Bill, or the Children's Rights Bill, and it would have taken away parental rights. And we put all force behind that. And we actually stopped it from it was introduced, but it didn't go anywhere after that. So that was a success. 2019, the medical exemption came back. Because of wonderful people like Dr. Sutton, who were writing medical exemptions, but there weren't very many in California. And so Senator Pan felt the need to crack down on those people, those wonderful doctors. And so our medical exemption now is basically obsolete. Even most other states have a medical exemption that's achievable. Our state has a medical exemption that is not. You can submit a medical exemption, it's revoked immediately by CDPH unless it's for titers or for oncology kids. And that's really the only people that can get a medical exemption in California. Last year was another big year for us. There were 10 bills introduced that were what we called bad bills. They ranged from, I would say probably the most extreme was the bill that would have required every single person who was an employee or a contractor in California to get vaccinated for COVID. And that did have a religious exemption in it because it had to. But between that and Senator Pan's bill to get all children vaccinated for COVID for school, you basically had a birth to death vaccination, would have mandated vaccination in California, COVID vaccination specifically. Thankfully, those two bills were pulled. I will say we are getting more savvy on how to put up opposition on bills. We basically killed or got pulled about 5 or 6 of those bills, which meant the author didn't move forward with them because of the opposition. And the opposition in most of those came from our movement, but came more primarily from another set of organizations. And that's where A Voice for Choice Advocacy and probably 2 other organizations were pivotal in that. In that, for example, for the employee one, we wrote and called every chamber of commerce. We wrote and called all the labor unions. So when you look at who opposed the bill that would have mandated vaccines for workers, it was primarily agricultural unions. It was police departments. It was educational organizations. And so those are all organizations that the Democrats in California need for their votes, for their elections. And so they won't, when all of those organizations come and oppose a bill, they are not going to move the bill forward. Our medical freedom we don't have the clout to do that. And so what we've realized over the years is to reach out to different types of organizations, especially the ones that support the Democrats in their election process and give them money. If we can get them on our side, I'm happy with them taking it away if it stops the bill. And that's something that over the years we've realized. We did end up with 4 bills in the legislature that did pass the legislature, did pass through and were signed by the governor. On those bills, A Voice for Choice Advocacy also over the years has realized that amendments are a key request. It doesn't mean to say we like the bill, but it is much easier to go into an office and request amendments to a bill to completely water it down or to put in a section that really protects parents or does something like that than it is to completely kill a bill. Now, it depends on the bill. And, one of the bills, SB 866, which was the minor consent bill, was very, there were people in our movement that were very much, we have to kill this bill. And there were others that were, well, let's ask for some amendments. We actually were both coming at it from the same place, because the other piece with amendments is it gives you talking points. It allows you to talk about why the bill is not a good bill as it is, and what the unintended consequences of a bill are. The bills so SB 866 was down to the wire. That would have allowed, initially would have allowed 12-year-olds and up to consent to vaccination in California. California already has a number of minor consent laws where 12-year-old and up can consent to abortion, they consent to treatment, drug and alcohol treatment, they consent to mental health treatment, they can consent to, what else is on that list? Infectious disease treatment, prophylactic infectious disease. So you can go, prophylactic STD. So you can already go and get the HPV vaccine or the hepatitis B vaccine if you're 12 and above without your parents' consent. This bill would have allowed any vaccination to be given to a 12-year-old and above if they consented. And what was interesting on this bill is that, our amendments, people were just like, oh my goodness, a Voice for Choice advocacy is asking for amendments. If our amendments had been taken, the bill wouldn't have been the bill. It would have basically, it was a poison pill. We asked for it to be raised to 16 years old. We said that the parents had to be notified, had to be called, and this was all in line with the National Vaccine Information Act, or National Vaccine Injury Act, sorry, where parents have to be notified before and given the vaccine information statement. And so we had said, that the parents have to be notified before, that the child afterwards, the parents also had to be notified that the child actually got the vaccine. They had to be given the the vaccine information statement, those types of things. And so basically we were using it as a poison pill. Somewhere along the way, Senator Wiener changed it to be 15 years old, but even at that, there were too many legislatures that just didn't want to vote on it. One other key thing about last year's legislation, which had never happened before, was that it was an election year. In California, our election years are every 2 years for assembly members, every 4 years for senators. And so 100 legislatures were up for election last year. And many of them, even if they didn't come back to the legislature, were running for other positions. So whether it was Congress or Board of Supervisors or something like that. And that was one thing that I would say really attributed to our success on SB 866, was that they were looking at this as, if we vote on this, it will be brought up in our elections. And we've seen, that in different states, as well as in California, that can have an impact. And these, anti-vaxxers, these medical freedom people, can really make a difference in your election. And so that was one of the reasons why I think many more of them were sort of hedging their bets and not wanting to vote on that bill. Anyway, last day of the legislature, Senator Wiener withdrew it, thankfully, so we didn't have to deal with that, but it had made it all the way through the legislature by a hair, and he had pulled some funky tricks in committees by replacing people and things like that, but it did get all the way through to the assembly floor. And so it was, and the question was, would the governor have signed it? Senator Wiener also has he puts forward a lot of legislation on the transgender issue. And I truly believe he had two bills. He had 866, and then he also had a transgender bill that would allow parents with children to come to California from other states and get transgender treatment. He had those two bills, and both of them didn't have the full number of votes. I truly believe that he also took his, he basically weighed it up. Which one of these two do I really want to put forward? And his passion is really transgender. And so he put that one forward and he got the votes. And I do believe that there was some, backroom conversations on that, that people had said, okay, take this one off the table and put that. We have no proof of that, but, I know enough about the backroom of Sacramento that I would guess that may have happened. The four bills that we had that did pass, all of them we requested amendments on. We got some amendments in a couple of them, but not enough for me to be happy, although the COVID testing one sort of has dissipated. So one of them was COVID testing in schools. That initially required for the next 2 years there to be COVID testing in schools. It got amended along the way. Again, that one at some point had the school administrators, I think it was, that came up against it, and they got this amendment. It wasn't us, we pushed the amendment, but they sort of tipped it over the table. So now the schools have to have, all public schools in California have to have a link on their website to their COVID policies, including COVID testing, as of July of this year. And they can use whatever CDPH, California Health Department, puts out, and they can just copy that onto their website. No school in California, or very, very few schools in California, are doing COVID testing anymore. It's, you know, it was a bill that we basically looked at and was just like, okay, this is obsolete. Our real concern by the end was, you know, they've passed this through. This now becomes precedent for other viruses. So can they put through a bill that says flu or, you know, RSV or whatever it is? Are we now going to school and testing for 50 million diseases before you enter the building, even if you're not sick, and using PCR tests, which are, you know, not worth anything. So, but we feel like, and that one hasn't, one of the things that we did get amended was that it had an expiration date. So it has an expiration date of 2025, I think it is. So at least that will go away in time. That one I'm not so worried about, especially right now, because it seems like we're off ramping, but you know, you never know. The other three bills, one of the other bills was SB 1419. That was a medical privacy bill, which again, this one, Senator Becker put this together. And it was interesting on this one. I was sitting in a committee hearing to go up and speak on a different bill. And I was listening to him speak and I was like, wow, this is a bill that we should support. It's, you know, it gives more medical privacy. We always want more privacy, you know, not doctors being able to share certain things. Wonderful. You know, this is great. And I went in and I read the bill, and it had, and interestingly, he did not bring this up in any of the committee meetings until I made a stink about it. And people and legislators started asking questions, but it had a line to do with the minor consent laws. So the current ones that are in effect. And it basically, because it was making the medical privacy more strict, it would prevent parents from accessing those records where their minor children had consented. And so we requested an amendment. We knew we weren't going to be, we asked, first of all, to just have that line struck out. And he said, nope, that's really important. You know, they need their privacy. They've obviously gone to the doctor by themselves for whatever reason, and they didn't want their parents to know. And so their parents shouldn't have access to medical records. And, you know, we always look for the unintended consequences, and the unintended consequences on that end is what happens if your child has a medical emergency, a side effect after going through some treatment, right? And one of the things is abortion. And so I would bring that up. I said, you know, what happens in the very rare event that your child comes home after having an abortion and they start hemorrhaging, and you find them, you know, in a puddle of blood and, you know, unconscious in their bed, and you take them to the hospital and you can't access the records. You know, did wherever they went, you know, cut something or do something that, you know, the doctor, it would be helpful for them to have those medical records. And so on that one, we asked for an amendment that in emergency or if they have a severe adverse reaction, and part of this, you know, we were looking at it from a vaccine perspective too, if they have a severe adverse reaction to the vaccine, and we know those happen, that the parent could get access to those records, or in the event of death. Those parents would be able to, but they would have to go to court and get them subpoenaed. And that takes time and money. And most parents don't know how to do that or have the wherewithal. So we're not successful in getting that. We were talking to the CMA, which is the California Medical Association. They were the sponsor of the bill. When the California Medical Association has a bill in California, they get their bill through. It is very, very rare. I would say it was one in 1,000, 2 in 1,000, where they have a bill that doesn't pass through the legislature. And that again comes down to money. They give a huge amount of money to the elections, and support certain people. And so that definitely fuels whether bills go through. We do on all of these, on these last three that we had amendments for, we have requested those amendments to be bills this year. We haven't gotten any of them picked up yet. The next one was AB 1797, which was the California Immunization Registry. What it requires is now as of this year, any vaccination that's given in California is put into the immunization registry. That didn't used to be the case. Many doctors and organizations like Kaiser and pharmacies put it into the CARE database, but it didn't used to be that way. You didn't have to do it. The key piece here is California is the only state in the US that does not have an opt-in or an opt-out of CARE. And with this, being a requirement to submit all vaccines, it means that there is no way for you to remove your information from that database if you're vaccinated. And so there are two avenues here. Number one, you can lock your information on care. And if you do that, then people like schools and nursing homes, WIC, can't access your information, but your information still remains in the database, and CDPH and the sort of back end organization, the government basically can still see your information. On this one, we started off with an amendment to have an opt-in. In other words, before your doctor gives you the vaccination, they say, do you want your information in the immunization registry? We realized in California that was too heavy a lift. There was no way any Democrat was going to vote for that. The one good thing about this bill is that we do have really strict privacy laws in California. We have the strictest privacy laws in the whole of the US. And it is a Democrat position to have this privacy. And so that works in our favor. And so we then came to the place of, okay, well, let's have an opt-out. Let's have a place which is what our consumer privacy is. If you, on a consumer side, on a consumer database, if you ask for your information to be deleted, they have to completely delete your information. And so we asked for that. We got pushback on that from CDPH because CDPH uses the data to claim vaccination rates. So for example, for the COVID vaccine, when you hear in California, 70, I don't know what the number is now, but 70 whatever % of people are vaccinated for COVID, that comes from the immunization registry. And they said, we really want to have those statistics that are up to date and correct. We don't want people removing their data. And so we came up with a sort of compromise of, okay, let's have an opt-out where the person can remove their personal identification information. So, birthday, name, address, those types of things, but that you can keep in there that, yes, rather than it's Christina Hildebrand, whatever my birthday address in that database, it becomes anonymized person, but yes, that they've had this vaccine. And so that was a compromise that was a partisan compromise, a bipartisan compromise. Both sides were open to having that as an amendment. We weren't able to get it as an amendment. We are, as I said, shopping that as a bill this year. We've had some interest in it, but nobody really wants to take on the vaccine issue some more. I think it's something that is a continued conversation that we want to get to. I don't know that it'll happen this year. And then the last one was SB, which one are we missing? 4097 was testing. Oh, AB, the one that's the topic of the week, AB 2098, the doctor misinformation. This one we have been, Voice for Choice Advocacy was extremely involved with, both in the legislature. We worked with an organization called California for Good Governance, who were part of the lawsuit that went forward. They put forward the constitutional argument. A Voice for Choice Advocacy helped with sort of the medical information, the misinformation definition. One of our biggest concerns with this bill, it was twofold. Number one, the medical board can already discipline for misinformation. Was our biggest argument, this is not necessary. We knew that the author and the governor wanted to sort of put a stake in the ground and say, California is getting rid of disinformation and misinformation. We've got the only law in the country to do this. But it was also specifically the wording of misinformation. So the definition of misinformation is it has to follow contemporary scientific consensus and standard of care. And our argument to that was, okay, you tell me what contemporary scientific consensus on COVID is, because it changes every week, every month. If you look at the beginning of COVID, we were putting people on ventilators, we were, doing all sorts of things. We were masking, we weren't masking, we were vaccinating, we were, holding off on boosters for a certain age group, whatever happens. And then who is the ultimate authority in this? So if Florida is doing something, or if the Mayo Clinic comes out with something, or the World Health Organization comes out with something, or another country comes out with something, if a doctor has done that research and has decided, yeah, masking doesn't make sense, or vaccines for under 50-year-olds doesn't make sense. COVID vaccines for under 50-year-olds doesn't make sense because there are 10 other countries in the world that are, taking that approach, a more careful approach. Where does scientific consensus come from? Is it California scientific consensus or is it world scientific consensus? We argued that it fell on deaf ears in the legislature. Again, this was a very politicized issue, and it was very much the governor wanted to put his stake in the ground, saying California is dealing with the misinformation here. We knew it was going to go to court, and this week there were 2 cases that were enjoined, and the judge in those cases agreed that contemporary scientific consensus made no sense. It was a preliminary injunction, so it still needs to go through the whole court process, but it has stopped that bill or that statute, so that cannot be enforced in California, which was a wonderful win for this week and a great option, or a great result. So that's kind of where we landed at the end of last year. I call that reactive legislation. And so we were very much reactive. We were very much in a year of just trying to, play sort of whack-a-mole on all these bills and try to sort of keep them away, keep them at bay. This year, I truly see it as a year of proactive legislation. And when I say that, so in our down years, when we don't have bills that are heavy, opposition bills, what A Voice for Choice Advocacy does is we look to get authors for bills that we have a bill that we're sponsoring, that we can have conversations with those legislators and build relationships with those legislators. And so this year, as I said, we have some of those bills that are amendments. We have other bills. Our mission is broader than just vaccines. We do educate and advocate for anything that goes into your body or around your body. So food, air, water, pharmaceuticals. In 2020, we had a bill that Assemblymember Christina Garcia took, and we got it signed by the governor, that as of January of this year, all ingredients on menstrual products are labeled. And that's the type of thing that we will bring forward to have the conversation. That conversation was, we wanted to have the conversation of my body, my choice. I want to know what the ingredients are that go into my body, those types of conversations, and have them with the Democrats. As I keep talking about Democrats in California, we have a super majority of Democrats. If you want a bill to pass, you have to get 50%, and therefore you have to have at least 30 votes that are Democrats. Half and half Democrat, Republican, and so it is really, really important to have those relationships with legislatures. We have a bill that was our idea that's being brought forward that would remove PFAS, which are forever chemicals, from menstrual products. We have another bill that I can't share right now, but that we believe has been authored. And so we're really looking this year. I don't think there will be any vaccine bills. If there are, the 2 that I could see coming up, there's been a push for the HPV vaccine to be added to the children's schedule. The legislature, Assemblymember Aguilar Curry, that has been sort of moving that forward, hasn't done it all the way. So last year she had a bill, or there was rumor that she had a bill that would have done that. She pulled it back to make the insurance pay for the HPV vaccine. That didn't get signed. It got all the way through, but it got vetoed by the governor. I believe she may be bringing that one back. I don't think she'll go all the way to having it mandated by the for the school piece, but it's always lingering. Senator Pan is no longer in office, thank the Lord. And so that leaves us with kind of a void. He created last year a vaccine working group, which was a group of about 7 legislators. It's all the legislators that brought forward these bills. And I think he started that to try and sort of create a legacy from himself. What we have heard through the grapevine is that group, it's not that they've disbanded, but they're not moving any vaccine legislation forward this year. And so we're really, really hopeful that, we have gotten sort of over this hump, and that there are a couple of legislators that we're worried about. And most of them are doctors or pharmacists, or, and they worry me. They're heavily supported by the CMA, but I think they're certainly not as gung-ho about the whole vaccine issue as Senator Pan is, and so was. And so I think we're, I'm going to say safe for the year, but I won't say that until the end of February when we see what all the bills are that have been brought forward. We do have lingering in California the COVID vaccine. The governor has said that he would implement the COVID vaccine, or he through CDPH would implement the COVID vaccine for K through 12 in January of this year. If that happens, there will be a personal belief exemption associated with that. That was in 277. That was part of the law that if the California Health Department adds a vaccine, that the personal belief exemption would be associated with that. And so we, our perspective is, at the very earliest, if the COVID vaccine were to be put into place for school requirements without a personal belief exemption, if it's not introduced this year, it would be introduced next January, and it wouldn't go into effect until 2025. And so, but my feeling with the whole vaccine issue, especially COVID vaccine, we don't have the flu vaccine required in California. If we had the flu vaccine required, which is an annual requirement, I think maybe, but now that they're going to COVID boosters on an annual basis, I don't see it being implemented by the legislature. I definitely am hopeful. Is there a small chance? There always is a small chance, but I really do feel that we're in an okay place from that perspective. So I see legislation happening this year. Unfortunately in California and most other states, when you have bad bills, everybody's riled up and everybody's going and everybody's, doing stuff and complaining and, going and meeting with their legislators and all the rest of it. Unfortunately, what happens in down years, everybody's exhausted and they have sort of, I'm going to say, given up, or they've gone and crawled under their rock, or they found a way around whatever the law was. They've moved out of state. And so on down years, we, from our perspective, it is the time that we get to build those positive relationships with legislators. And we really request that all people do that, but we also understand that in a down year is when people catch their breath and are, as I said, have worked out what they're doing with their life. On that front, we do so A Voice for Choice Advocacy has a project called Stand Up California, which is our grassroots organization. We are in every county in California, and we are actually relaunching that. We just hired somebody, Karen, she's amazing. We just hired her to sort of take that on, and we're having a relaunch of it on Monday evening for people who want to get involved on a district level and go to Board of Supervisor meetings, go to school district meetings, as well as the legislative meetings. Just to talk about Board of Supervisor a little bit, the Board of Supervisors is who hires and fires your public health officer for that county. So when we saw during COVID, some counties have really, really strict COVID policies and other counties not have as strict COVID policies. That was your Board of Supervisor who hired that person to implement those policies and had a say over that, which is why Board of Supervisors and getting more local is really important. The school board hires the superintendent, again, who implements policies into the school district. And so, it is important to get onto that local level of things, as well as just our legislative level. We don't go above our state legislature. We don't do things in Congress very much unless there's a pressing issue or big issue. We don't usually go up to Washington, D.C. just because we don't have the bandwidth. And there are other organizations on the specific issues that sort of that go to that place. Stand for Health Freedom is one of those. When they have some things at the federal level that they put out, and we'll put those out as well. So that's sort of where I sort of gave you a history and where we're headed this year. I am happy to answer any questions on that. I'm happy to. I know there is there's one in the chat. You can either I don't know how you usually do it, so Christy, you let me know if this is okay, but I'm happy for people to come on. I would ask if you have a video and you're going to ask a question, just so that I can see your face, because I like talking to people and not just names. But feel free to ask your question, or if you want to put it in the chat, I'm also happy to do that. I do see one in the chat. that says, is anyone speaking about geoengineering? So there are a couple of loud voices in California, although I don't feel like they're as loud as they used to be, but maybe I just am not hearing them, that have talked about geoengineering. It is not a topic that has come up in the legislature. I think that, you know, the way that when we talk about it very much from an air pollution standpoint. Again, we look at everything through the lens of what are the Democrats going to hear? And it's really a matter of hearing. If you come in and say the words geoengineering or chemtrails, literally this is what happens in the legislature amongst Democrats. And so it's part of the nuance of this is working out what are the words that they can actually hear and understand, and that you can sort of penetrate their brain. And so when we go in and talk about geoengineering, we don't necessarily say the words geoengineering, we don't say chemtrails, we also don't say contrails or use those words, but we talk about it more from a pollution perspective. So we have had conversations about the amount of pollution that airplanes put out, for example. Like everybody thinks about their car, and California is all about, you know, electric cars, but look up and look at how many planes are flying overhead and how much they're outputting. And, you know, some of those planes include, you know, those planes. And so we look at it from a wildfire perspective of what is coming down from the rain. What does our rain look like? Let's analyze the rainwater, those types of things, to try and get, you know, I'm very much about it's not how we talk about it, it's what the end effect is. What do we want to happen? So if we want them to get that out of the sky, then let's talk about what's in the sky and what's in the water as a first step, and then get them to a place where, oh my goodness, all this stuff is coming out of planes. Let's, you know, put some ban on planes, you know, or on what exhaust comes out of planes, that type of thing. So I wouldn't say geoengineering is being talked about. So air quality is definitely something California cares about. Water quality is something California cares about. I don't think the whole geoengineering is, they won't admit to it. Let's put it that way. They don't want to hear about it. They don't want to admit it. They don't want to be forced to open their eyes on something like that. So they keep their eyes closed and their ears closed. Does anyone else have a question?
I have a question.
Yes.
I was wondering what you recommend to do when a legislator or leader is lying or twisting facts. For example, our mayor in Berkeley throughout the pandemic was saying, along with the health officer, that no one had been injured or harmed or died from the COVID vaccine.
Yep.
It's completely safe and effective. You know?
Yes, it is really, really hard. I live in Santa Clara County. We have a health officer just like that lied like so much. And then, you know, came out a year later and was just like, oh, I'm really concerned about the death certificates. I think we overcounted the death certificates. And it's just like, we've been trying to tell you this, but you won't listen. It is really, really hard. And is Carl still on the call? I don't see. I think he may have, oh no, he is on the call. Carl is amazing at putting documents together to counter these things. The real question is, you know, you can go and you can make the point, but they just don't want to listen. They've got it in their, you know, they've got their blinders on and they have the statements that they want to make. And sometimes I don't even believe they believe the statements. I think most of the time they do. I think they've been completely brainwashed. You know, where I always come back to the book Tipping Point, right? So when you have a mass of people that are saying something, it brings it to a tipping point. And so my recommendation, and it's hard when you live in places like Berkeley and Santa Clara County, where, you know, I still go out for a walk with our dog and people are wearing masks on the street by themselves, you know. It's really, really hard when you're the minority. But the question is, can you build it enough and have the statistics to back you up that you can bring forward, that you're not considered, you know, the crazies that, you know, have this other opinion, but that you actually bring it forward to becoming more mainstream, more, you know, and can you plant the seeds? I mean, the other piece is, you know, I find very often, and I do this, but I over the 8 years that I've been doing this, I've realized you have to break it down and you have to plant one seed at a time. So can you bring up something that specifically is about, that again, speaks Democrat, speaks their language that they're interested in, but can you put a little twist on it, right? I think that happened with the whole transmission piece. I mean, the minute I saw the clinical trials, I was like, they don't have transmission as an endpoint. What the heck are we doing here? But I was extremely early. I was a year too early. They needed to see it in effect. And even when people got the vaccine and got COVID, it was like, oh, that's just a minor that's just minor. That's just your breakthrough cases. No, everyone is breaking through on everyone. So it is, part of it is really hard. I'm just going to say that. And it's really hard to get through. But I think it's educating people that you can educate, and most of those are not the mayor or the board of supervisors or the whoever it is that is so gung-ho and paid. They are paid, they get pharmaceutical lunches, whatever. I don't know what the mayor got, but it's very much that group think. It's that World Economic Forum group think that they think that they are the upper echelon and they know best, and that these are just the people they need to control and pacify, kind of thing. I think it's very, very hard. I've traveled a lot in the last 3 years, unlike most other people in this area where I live. But when you travel to other places, I mean, you go to other states, it isn't like this. It doesn't function like this, and it's part of why I love California, but at the same time, I understand people who are leaving California, because if I didn't have to be here, I don't think I would be here either. But I do. I still have kids here, and I'm divorced, so I can't leave. But yes, did that answer your question, Christy? I know it wasn't I wish I had a slam dunk answer, but
Yes, no, that was very helpful and reassuring. Anybody else?
Question?
Yeah, I guess kind of following up on Christy's question a little bit. I admire what you do so much. Thank you. It's
nice to finally see you and meet you, because I've seen your name many times, but
well, wonderful to meet you as well. So I'm wondering about your psychological game, because you are up against a tsunami, and it's amazing your strength, right, and your consistency. I spoke with Carl last week, and what I see is that you, as well as Carl, you're able to work so well within this system that is working so horribly against you, right? And I guess I wonder, because I just want to burn it all to the ground, and you're so amazing at keeping the fight going. And can you share your toolkit for survival? What's your psychological game?
I can try, and it's interesting because so last year we hired 4 people for a Voice for Choice advocacy, and one of them sort of pushes me. She only joined halfway through the year, and she sort of asked me these questions, so I've kind of reflected a little bit on it. I think so number one, I'm passionate about this, but number two, I think it's the mindset that I have and who I am as a person, that I I try to be very even keeled. So I don't my cortisol levels go up, but very little stresses me out, if that makes any sense. Because I am a very solutions oriented person, and my kids hate me for this at times. I'm like, okay, what's the solution? Let's go. Let's work through it. Don't worry about, don't sit there and whine about it. Let's work out what we need to do to get it right. And that's, I think that piece of it is where I come from, is very much looking at the solutions. I also recognize that, I have said this many times over the years, I play in the sandbox of the legislature, and I actually enjoy talking to them and educating them, and because I see it moving forward, I see the relationships building. I think this year especially, we've talked to legislators and their staffers, and the respect they have for our organization and what we do, because we bring it very much with science backed and very much from an even keel place, from a I wouldn't say it's not emotional place, but it has emotion in it, but it's a very it's not a desperate place. I think it's the difference in that emotion. And I think the other piece of it is that I look for, as I said, I look for solutions. I look for how can we make this better? How can we deal with it? But as I'm playing in that legislative toolbox, I also very much am a proponent for a plan B. So how do you not play in that toolbox at all? And how do you get out of the system? So from a healthcare perspective, from a education perspective, from a financial perspective, from a like all of those pieces, like I'm always looking at what can I do? Food perspective is the other one. Like what can I do to not have to deal with the system, right? So, and I also don't look at that as black and white. I am the type of person, I will never go live off the grid under a rock and be happy, you know, and cultivate my own food and create my own energy and, you know, all my financial resources and whatever else. I'm just not that person. I am a person that I grew up in a big city. I grew up in London. I lived in New York City. I love big cities and I love living in a place where there's food and theater. And, you know, that's what's important to me. If I didn't have that, I would not be a happy person. So in looking at it, I know I'm going to have to live in some of this, you know, in some of this. And how do I extricate myself from it as much as I can? And that's doesn't happen overnight. It's, you know, I planted a summer garden or spring garden last year, 2 years ago. And then this year I did a winter garden, and that's the first time I've done a winter garden, and it's growing and I'm looking at it going, oh, wow, I didn't know we could do this. Okay, this is cool. You know, from a food perspective, do I grow all of our food? No, I don't grow all of our food, but it's fun. And it gives me some sort of, okay, if I needed to do this, if we came to the place where I needed to do this, I know I can do it. Those types of things. So I think it's having that balance. But I still come back to I'm a very solutions oriented person. And I think the other piece is that I really try to, you know, I believe California will come back. I believe we're in a cycle. I think we have swung so far this way. It's going to come back, and we're going to come to this place again. But it's going to take a while. And I completely understand people that are moving out of California. As I said, there are many places in the world that are better than where we live, especially where I live and some of you live in the Bay Area. So I don't know if that answers your question, but it gives you a little bit of insight of where I come from. Thank you. Does anyone else? Carl,
I got something.
Sorry.
Let's go, Carl, and then Heather.
Okay, so I would just say, yeah, on terms of getting the injuries in, one of the things Informed Choice Washington is doing is every time they're finding whether it's a city council meeting or county meeting or health board, each of our counties has a health board that is overseen by either the county council or some consortium of different political leaders, with the idea that that when they're spending public money, that elected people have to be in control of it at some point. So they're doing, they're finding people who've been injured that can go in and do a testimony. And oftentimes these are being recorded so that we're trying to build up some sort of yes, exactly. And then, in terms of that CMA thing, these medical boards, in terms of potential future legislation, I'm trying to figure out a way to create a separate medical board for the complementary and alternative medical people, because when I was helping in Vermont, we had a tremendous amount of support by the Vermont Chiropractic Association. And I think they spent maybe 50 grand, and they were deep in with us. Then the following year, the Vermont Medical Board took away, reduced their reimbursements and also constrained their scope of practice, so that by the time 2015 hit, I spoke with someone in Oregon, because all of our what should be natural allies, which would be they've been warned off that if you do any kind of an organized aid to us, that we're gonna go after them.
And that happened in California too. So in 2015 with SB 277, the chiropractors were lockstep on our side. The next year, California removed chiropractors from I think it was we have Medi-Cal, which is similar
Yeah.
to Medicare. They removed them from that funding. So
Yeah.
they no longer could get reimbursements from Medi-Cal.
Yeah. So these people are evil.
Yeah.
That we're up against.
Yeah.
But
and I wouldn't say it was the board. So for us, it's very much the medical association. So the California Medical Association is the group, is basically the trade organization for doctors. The messed up thing is they have so much clout, yet so there are about 140,000 doctors in California, only 40,000 members or only 40,000 doctors are part of the California Medical Association. And the majority of those are either through Kaiser, which if you are a doctor at Kaiser signs you up for the CMA, or they are fellows or like students that, I look at it, I do market research, and, there's a trade organization for market research. And when in my first 2 years out of college, when I was starting up this career, it was like, oh, I have to be part of the American Market Research Association. I have to be part of it. I go to their conferences and everything like that. And then like 2-3 years in, you realize, okay, this is just a waste of money. Like, great going to the conferences, but like, I don't need to be a part of this association. And I think the same thing happens, all of these, I'm going to say kids, these fellows and these residents and all the rest of it are part of the medic. So the CMA does not actually represent doctors in California, yet they have so much clout, and they can, they say they represent doctors, but they really don't, which is
right. That's like the AMA maybe has 25% of doctors. Yeah,
exactly. Yeah.
But no, I just I admire all the work and am a fan from a distance.
As I said, I appreciate you too. And you've been there since 2015. You're one person that it was like, we need to get a call from Washington. So.
Well, I'll tell you what, I've got my last 3 videos. I'm really honing my message in terms of teaching the legislators that the attack on the childhood exemptions is to go after adult mandates. And then I just did one last week about with Bernadette Pager on Children's Health Defense about, this crap about the falling vaccination rates. What's amazing is that they're not going down.
Yes.
That the everyone's still doing all the regular shots, which is kind of astounding to me.
Yeah, I agree with you. And those numbers, and I appreciate, I'm going to go watch your ones. As I said, I know I have them sitting in my inbox still of like, I need to read I need to listen to these.
Oh, there's so much to cover right now. Yeah. I'm constantly, everywhere I drive, it's a podcast or, I'm constantly trying to keep up.
Yeah, no, I agree.
Very good.
Stacey. Thank you, Carl.
Okay.
Stacey.
Lily next, and then Stacy.
Oh, sorry. And Heather had a question too. Did Heather ask me the question? No.
Hi, Christina. Oh,
yes.
I'm sorry. Should Heather go first?
Nope, go ahead. I don't see Heather.
Hi, I'm a huge admirer of you and your work, truly for years, and follow your work. You're an amazing person. And now we know about all your resilience and all your, high aspiration and all your toolbox. So that's amazing. Not everybody, I guess, is graced with this positive outlook like you. And my question, and a lot of us struggle. So my question to you is, with all the knowledge you have about what happened, is to ask you, what do you project for California? What in your mind could be the future for California? I will specify. When I go around, it's just haunting thing for me. When I go around and I look around and I see those kids on the playgrounds, children going to schools, the horrifying thought in my mind always is one: all of those are vaxxed. And that's what I tell my daughter. There's no option for you to be different. There's no option for you to stand out. There's no, as you stated, the medical exemptions obliterated effectively in California. So with that fact, does that mean that everybody's just taking a pill and everybody's just going along to get along, or everybody's essentially sacrificing their children and their beliefs and their inquisitory minds maybe? How does it work? Does that mean that maybe there's an percentage of alternative education ways? Homeschooling, is it on the up? At which degree? At which stage when it goes? How high up it needs to go so it starts to making a difference? Is there any hope for California? I guess that's just summary. It's a big question. I know it's a lot to ask, but you would be the person, the ultimate person to ask.
Well,
then I would have to ask God, but I do not know how soon the answer may come.
Is there hope for California? My answer is yes. Is it imminent hope? No. I think, so to get to your specific of schooling, I think the majority of people in California, and I will say, more and more the people that are awake are leaving California. So it becomes more and more, what's the word? Centralized into the people that are left, that are in that mindset of, they just don't question. They don't question the vaccines. They don't question the schooling. They don't question anything. This is the way it is. This is a good thing. We've been told it's a good thing. We're going to do this. I will say that, so I worry about that. I worry that California over the years has become more and more blue because the people who don't think that way are leaving California. Having said that, I do think that there is a growing, I know that there is a growing homeschool group, community. And what's interesting is it's not necessarily just revolving around those people who don't want to vaccinate their children. This is, one other thing that I always say, I always look for the silver lining in things. If it weren't for 2015, I wouldn't be here because I wouldn't know Kelly Sutton. And I wouldn't have gone, I wouldn't have gone down this path. So I look at it, I wouldn't be on this call if it weren't for 2015 and what happened here in California. If it weren't for COVID, people wouldn't have woken up to how bad the education system is. There are a lot of parents who did not end up putting their kids back in school and are homeschooling their kids, not because of the vaccine issue, but because they realized that, wow, there is so much more opportunity for when I'm homeschooling my child as to them being in a public school. Now, when I first started in 2015, before that, if somebody had said, oh, homeschool your kid, my impression of that was sitting at the kitchen table with my child, actually teaching my child how to do stuff, and it's on me. I was like, there is no way I could ever do that. I don't want to do that. I don't want to spend the time. I'm not, I mean, am I educated enough to do it? Yes, I am, but that's not my passion. If it was, I would be a teacher and not do what I do. But what's happened in the past 2-3 years is that these groups of homeschoolers have come about. And so that there are groups of parents. I mean, in COVID, this is what triggered it, was, there would be a class of 8th graders and the parents were like, our kids aren't learning anything. They're not on Zoom school for the first 4 months. They're just not doing anything. We're going to hire a tutor to come in. Let's bring these, 10 8th graders into our house. We can swap houses every day. So we're not like, bombarded by 10 kids in our house, but let's bring the 10 kids together, have a tutor that teaches them what they need to be taught and move on. And what parents realized was, oh, this is actually a way you can do homeschooling. And, people who have been doing homeschooling for 20 years know this. This is how they did homeschooling. They would get together, twice a week at the farm or for physics lab or whatever it was. That wasn't how I knew how I envisioned homeschooling. And I think it isn't how most people envisioned homeschooling. But I do think that there is I know there is a growing homeschool community that is doing it in these sort of hubs or, enrichment centers, those types of things, that it's growing. So I do see people exiting the matrix, so to speak, and creating their own thing. Do I think it's the norm? No, I don't. And I think, the biggest piece for me, people ask me, what's the one thing we could change in California to make a difference, to change where we're at? And it's the election process. So about 10, maybe now 15 years ago, California voted on a ballot. And I remember voting for this and thinking it was a great idea and not really understanding not at all understanding the ramifications. We've changed our election process to the top 2 people versus the top 2 parties. In every other state, other than I think maybe Washington, actually, but there's one other state that does it our way. If you have, let's say you have 3 people running and it's Democrat, and a Republican. In the primary, in the general election, the Republican and the Democrat go against each other, even if one of them didn't get the second number of votes. In California now, if you have a Democrat, and a Republican running, and let's say the Democrat gets 30% of the votes, the other Democrat gets 20% of the votes, and the Republican gets, hang on, you need to be even. So 40%, 38%, and 22%, right? So in any other state, the top Democrat would run against the top Republican. Here in California, you have the Democrat running against the Democrat because those are your top two people, not your top two parties. And what that has happened here in California, what that means is that we have Democrats running against Democrats in nearly every race in our districts. And so people don't have that, there often you would have a Democrat when you have a Democrat Republican race, that a third person may not, the people who voted for that third person may not like the Democrat. And so they'd vote for the Republican, and the Republican has a chance of getting in office. I don't know if I explained that clearly enough, but it basically, because of that, it means that we have a supermajority in California of Democrats, whereas we could have more of a balanced legislature, and we did before this bill or before this ballot initiative, of having more Republicans in there, that the Republicans actually have a say, that the Democrats actually have to work with the Republicans. Right now, the Democrats don't have to work with the Republicans at all here in California. So hopefully that answered. Christy, you're keeping track of who goes next. So
I am. I think so. Heather, did you have a question? Okay. Stacy?
Hello.
Hello, Stacy.
So my question, just maybe also an observation, is you had said earlier that the legislator respects a voice for choice advocacy, and so that you guys are making headway, which to me is very positive and encouraging, because that hasn't been my perception of our legislature, especially when I've worked behind the scenes to help get meetings with people, especially with like AB 2098. I was working to get doctors to have meeting with the actual legislators, and of course they didn't want to meet, so we were meeting with their staff, and there were, on more than one occasion, they were just so rude, so disrespectful, and like they didn't want to hear what you had to say. They didn't believe what you had to say. So I guess I was surprised to hear you say that. I'm encouraged, but I'm surprised. And I'm wondering, is what we experienced kind of the minority of the legislator there, or was it specific to the bill, or because I give you kudos, because I don't like dealing with the legislators and the staff. The fact that you can go there and have meetings with them, I very much appreciate that you are the one willing to do that. So I just, if you can kind of speak to that more, maybe a little bit, and because I'm very encouraged that you're saying that there's people there in Sacramento that are listening.
So I do think I'm not surprised, let's put it that way, by the reactions that you got, or by the meetings that you got. I think it's multifaceted, as everything is. I think one of the pieces is that, so number one, you mentioned legislatures versus staffers. Okay. It is very hard to get a meeting with a legislature if you are not a constituent. Okay. And we work very much with the staffers. Does that mean we don't get meetings with the legislators? No, we do, but the norm is the staffer. And I actually like working with the staffers. Initially, when I started this in 2015, I was like, we need to meet with the legislators. We need to meet with the legislators. And they do. So one thing to keep note of is the staffers absolutely are gatekeepers. Okay. And they absolutely, not everything you tell the staffer goes to the legislature. So you have to be aware of that. But the staffers also have an incredible amount of influence on the legislatures. And that's where we build relationships with the staffers. The other thing is the legislatures are only ever there for 12 years. The staffers are there for a lifetime usually. And so like this year, there are 37 new legislators in California. And for the most part, I would say 80% of the people staffing those new legislators are people that we worked with last year in a different office. And so building that relationship means that we are, when they move into this new office and have this new legislator, we've already got a relationship with the staffer, and we have that, we can, that helps us with that legislator. So staffers are really important. Legislators are important too, because as I said to you, we never know what we've said actually makes it to the legislator. And that's a problem. And we've seen that in every single bill that we've had. We also know which, because we've been doing this for 8 years, when you have a relationship with the staffer, you know how much they're going to share. You know what you can say in order for them to share it. I think 2098 and last year specifically, because there were so many bad bills and legislative staffers and legislators were getting bombarded with these bills. It was definitely harder. We got meetings with any office we asked for, but it was harder to have those conversations. Now, I will say that our 7 years in the building is what got us the conversation and what had us, I won't say all of them listened to us, but and took in what we were saying, but for the majority they did, because they know when we arrive on the scene and have a conversation with them, we are coming from a scientific perspective, we are coming from a even balanced perspective, and we're talking their language. So when I look at a legislator, I look at them and their staff, what are they impassioned by? Is it homelessness? Is it education? Is it, this, is it that? And I tailor my argument or tailor my conversation to what they're working on. So if it's homelessness, I'll bring in, equity, diversity, low income, those types of arguments. If it's education, I'll bring in the education side of things, even if it is a bill that doesn't have that in. Also, our legislative director is absolutely amazing, and she will find those nuggets, and she pipes in. She's like, and also thanking them for the work that they've been doing, so that what they've been doing. So she always has, she sends me, before every meeting we have, she sends me a paragraph on the legislator and what bills he passed last year and what his passion is, so that we can integrate that into our conversation of, we're really thankful for the bill that he passed on getting PFAS out of textiles, that we've acknowledged what they're doing well and what they're doing. And so that's come in 7 years. And so I do find, especially when it's a really politicized bill, that if you just have people coming in and, even if they're on a certain side, if you just have them coming in and sort of bombarding them with information, bombarding them with, this is my story, you need to listen to me, and I'm telling you this, it's not always effective. Hopefully that helps, Stacey.
Thank you. I think we have one more question, and that is from Arzu.
Yes. Hello. Thank you, Christina, for everything that you do.
Oh, you're welcome.
I was wondering if you had a relationship or were aware of any individuals or groups at a local level in the city of Berkeley and the city of Oakland that is active and has their pulse around voting time, which candidate to, consider, not consider. Because I know you send the emails with your disclaimer that while you don't tell us who to vote for, these are the people that we think, yes. Right?
There's the other the other group. So there, I would say, you've got what, 3-4 people here on this call that are from the Berkeley area.
Oh.
So
yeah, well, we're not the active ones right now.
No, I know. But there is so there are individuals. I don't know that there is an actual group. I do know of individuals that are very active when it comes to election time, and I could probably put you in touch with them. It's tough on a local level, and I wish, this is where I wish we lived in a small state like Vermont or somewhere, because there we would put out a whole list of everyone, not we are, the other group, California Families for Health Rights, would put out a list on every level. In California, because we have, we've got 100 legislators that run for office every 2 years. That's just on the state level. You've then got Congress, and, you know, the House of Representatives above that. And then you have then you have every county, we have 52 counties, has a board of supervisors election where 2 or 3 of them get elected every year. You have the mayor, you have the city council, you have the school boards. I mean, there is so many, so many people running for office. Even if you just take, the city of Berkeley or Oakland, there are so many local elections going on that it's really hard to do unless you're in that city. And so that's where, but I don't know of any groups that specifically are looking at elections I know there are individuals, let's put it that way, that got very involved in trying to work out who to vote for and who are the right people. But realistically, it's looking at, I think it's more individuals than it is any groups or organizations. I do know, like, there are certain counties, like Orange County, I don't remember what their name is, but there was a group that put out, all the local level on Orange County level, that they had taken that on and done it. Our hope is with Stand Up California, our grassroots organization, is to kind of build, we're going to have representatives from every county, and to build that into it. I'm hopeful that in 2 years' time, or a year and a half, November 2024, that we will have more of that in place. I'm not promising it, but my thought is, if we have people that are involved in a local level, on a county level, that we will have people that are also into the elections and understanding the elections in those areas.
Thank you.
And that's Stand Up California kickoff meeting is Monday evening, is that correct?
Monday evening, yes. And if you want to register for it, it's on our Instagram, for sure. But it's and if you're on our email list, you would have gotten 2 emails about it. And if you don't have it, I will I can find the Zoom link and post it. But yes.
Well, I really appreciate it. Thank you so much.
You're welcome.
All right. Well, thank you so much. This was so fruitful and informative, and
You're welcome. It was good. And it was good seeing everyone, putting names to faces. So it was lovely.
Thank you, Christina. It was very, very good. Very good.
Thank you. You're welcome.
Christina.
All right. And I will,
Thank you.
when you put the video up, if you could send me a link to that, I'd appreciate it.
absolutely.
Thank you.
Thank you.
You're welcome. Bye-bye.
Thank you.
Bye,
Bye-bye.
bye all.
Bye.
Hi, Kelly.